Hi, thank you for joining us. We're the Taggarts. My name is Amanda and this is Jordan. And we're the parents of a 3-year-old boy named Jake who was diagnosed a year ago with TANGO2. And we're just at the beginning of this long journey with Jake and other TANGO2 families. And we're hoping that this interview of frequently asked questions helps increase awareness or helps newly diagnosed families. Because for the first year, for us, there was no reason to suspect that our son had a life-threatening illness. I had a smooth pregnancy and things always checked out healthy at prenatal screenings and doctor's appointments. Jake was born a healthy baby. But looking back, we noticed signs of developmental delay around 9 months when he wasn't crawling yet and not even moving to roll over. I would see him tense his arms and leg muscles as if to figure out rolling over, but it's like he wasn't able to make that mind-body connection happen. Also, during that first year, Jake came down with cold and flu more often and would have a really hard time recovering from illness. And then at 16 months old, Jake began to struggle on a daily basis with unusual episodes, having ataxia symptoms like extreme lethargy, loss of muscle control and coordination, muscle stiffness, excessive drooling, unfocused eyes, and loss of balance. And despite numerous physician and emergency hospital visits, blood tests, neuromuscular tests, EEGs, MRIs, and every possible screening, no one could explain the seizure or stroke-like episodes. Our child was no longer meeting his milestones, and as parents, we were deeply concerned about his developmental delay, but we were worried sick about these scary neuromuscular attacks when he would almost lose his ability to function. He couldn't use his hands, sit, or hold his head up. He would choke on food from difficulty swallowing and sometimes even barely seemed conscious. So as the frequency of these episodes increased, Jake's overall condition worsened, and it became alarmingly clear to us that he was regressing in his abilities as he was no longer able to crawl or stand. Everyone we told said that they had never heard of anything like this before. And because his tests always came back normal, doctors were perplexed and unable to find answers. So with no diagnosis and continuing to watch our little boy deteriorate was heartbreaking. So this brought us to countless hours searching the internet in the middle of the night, endless reading and researching symptoms on our own in hopes to find answers for our son. And then around Jake's second birthday, we learned the serious nature of these symptoms by receiving the full exome sequencing genetic test results, and Jake was diagnosed with ultra-rare TANGO2 related disorder. We also learned that my husband and I are both carriers for this rare genetic deletion. So this is a recessive genetic disorder and no one's fault. It could not have been prevented or predicted through the prenatal screening available at that time. TANGO2 is a type of neurodegenerative metabolic encephalopathy. From our understanding, this means that his body does not make energy correctly, his cells do not deliver proteins or remove waste correctly, and over time, this can damage his nervous system and brain. All kids have presented differently, but we were told that this diagnosis would come with physical and cognitive disabilities. And even more concerning, our little boy would be hospitalized from a metabolic crisis, rhabdomyolysis, which is a rapid muscle breakdown, or a cardiac arrhythmia at any time. In hindsight, Jake's reoccurring illnesses could have eventually resulted in a metabolic crisis, and we are beyond grateful that it never reached that point. And this is precisely why awareness and an early diagnosis is so crucial. The timing of his diagnosis led us to answers that we were searching for in order to help Jake. The diagnosis has made us aware of triggers and early signs of a metabolic crisis, and most importantly, how to make a care plan and monitor and protect Jake. However, very little is known about this disease. No approved medicines exist, and without significant research, TANGO2 children will remain at risk. So we are so thankful for families that are working together with TANGO2 Research Foundation and clinical leaders to guide treatment and increase awareness for families caring for TANGO2 children, which gives us such hope for the future. And so with that being said, we're very excited to welcome Dr. Mackenzie. Dr. Mackenzie's research interests broadly involve developing new ways to restore motor function in patients with neurological disease and developing treatments for patients with neurological conditions. He became interested in TANGO2 disease after encountering several children with the condition during his residency training at University of Michigan. And today he's going to be answering commonly asked questions for newly diagnosed TANGO2 disease patients and families. So this content is not to be a substitute for professional medical advice, diagnosis, or treatment. And always seek the advice of your physician or qualified healthcare provider with any questions that you may have regarding a medical condition. So welcome and thank you, Dr. Mackenzie, for doing this with us today.
So why don't we get started with just, starting off with a little more background on you. Wanted to just learn a little bit more about your experience with TANGO2 and tell us maybe a few examples of your first encounters and what drove you to learn, discover, and engage more in the TANGO2 community.
Yeah, thanks, Jordan, and thanks, Amanda. It's really a pleasure to be talking to you guys. One of the best parts about plugging in with the TANGO2 Foundation has been meeting families like you and seeing how engaged you are. I have to say that for me, I didn't find TANGO2 disease. It sort of found me, probably similar to your experience with it. I was, as Amanda mentioned, I was doing my pediatric neurology residency at Michigan, and ended up by the end of that 5 years of training, seeing 3 families, 5 total patients who had children, 3 families with children who had TANGO2. I was involved in the diagnosis of one child, and without getting in too much detail with personal privileged health information, that child had a cardiomyopathy and sort of all of the cardinal features of the disease with the ataxia and seizures and the muscle breakdown. And really, it was the muscle breakdown, the rhabdomyolysis, which cued us in on thinking, that could be what's going on. We actually recently diagnosed another child here at Nationwide Children's, and from some of our partnerships that we have going on with the Broad Institute, we think this may be more common than was originally thought. So jury's still out on that, but we are really engaged with diagnosing more of these kids. There are a few things about the disease that made me interested in it from an academic standpoint. I think first, there's the basic mystery about what's happening in cells that don't have the TANGO2 protein present. We know that some of the work in fruit flies, it looks like this might be involved in protein trafficking with the Golgi and endoplasmic reticulum. Those are parts of the cell. And then, in kids, if we're looking at sort of the symptoms and the way they present, it does look a lot like mitochondrial disorders. So there's sort of this dual role that's been kicked around for this protein, and a lot of researchers are really actively engaged in solving that question. Number two, having been exposed to gene therapies for other neuromuscular diseases, TANGO2 really strikes me as a tantalizing candidate for gene replacement at some point in the future. And so we're using that therapy for spinal muscular atrophy, which used to mean a death sentence for kids on a ventilator with really nothing that we could do to help. And now some of these kids that get treated early are on monkey bars. It's really amazing to see. And then finally, as I said, I get to work with awesome families like yours and really try to move things forward with a motivated team of people.
Well, we're so appreciative of all that. And yeah, I think, like you said, the families and those that are participating in all the committees and the research is giving us all hope, right, for what may be in the future. And now that we're focused on discovery, more so, than a lot of the families that didn't even know what this was just a few years ago.
Right.
So maybe just to start, I think to your point, this can be pretty overwhelming for new parents, right? There's not a lot of information about it. It's all happening still in real time, and new information's, being shared and researched as we speak. So when you've encountered some of the families either at Michigan or Nationwide Children's, what are some of the first things that you've advised them? We focused on, as soon as we got the diagnosis, coming up with a care plan, identifying our team of physician experts that we could in our where we live in our
Yeah,
community.
And identifying what our son's baseline health was. So our number one concern was safety and how do we keep him safe?
Right.
So, how do you advise parents on where to start when they're newly diagnosed and be prepared in case of an emergency?
Yeah, so that's a great question. And I think the approach that you guys had is totally appropriate. You want to bring in a motivated team of people. And by motivated, that's finding physicians that are going to do the reading, because no one is going to be an expert on this condition unless you go to, one of a few centers in the world. So that's finding a geneticist, likely a good child neurologist that's comfortable treating epilepsy. Sometimes it might be, another specialist within neurology, a neuromuscular physician like myself, or somebody who's involved with movement disorders. And then the big one is cardiology, right? So we know what kills kids with this condition is typically the cardiac complications in the form of the cardiomyopathy that might be more longstanding, or the tachyarrhythmia. So when the heart starts beating too fast in the setting of metabolic crisis. So finding a good cardiologist who kind of understands those things is really key. And you had talked about safety. So I think we'll get into it later in the conversation, but really having a good emergency plan.
Okay, so what is rhabdomyolysis and what are some signs of rhabdomyolysis?
Yeah, so rhabdomyolysis, like you said, Amanda, it's basically the breakdown of muscle. And in a patient who's experiencing it, especially if they're not able to communicate what's going on, it might be kind of hard to detect. But it can be decreased movement, kind of soreness, kind of non-specific pain. If you're seeing that the urine looks dark, we say tea-colored, that is an indication that some of those muscle byproducts, namely myoglobin, are present in the urine, and that can be pretty dangerous to the kidneys. So the main thing we do is really hydrate as much as possible to keep them really well flushed out. But a lot goes into preventing rhabdomyolysis, and we think rhabdomyolysis sort of goes hand in hand with metabolic crisis. So when those muscle cells aren't getting enough energy or not producing enough energy and really are under stress, there's something that happens inside the cell that causes them to break. And we've talked about, ways to prevent crisis with a lot of families. That can involve avoiding fasting, having snacks or juice on hand when you're leaving the house. From what we can tell, TANGO2 is involved somehow, either directly or indirectly, in metabolic function. So it's really important to keep kids, appropriately fueled, especially if they're sick or under some other form of stress. The other thing families ask about a lot is anesthesia. And we do know that certain forms of anesthesia should be avoided if possible. And so it's important that if your child's undergoing some procedure, that everybody on the team knows about this disease and does their homework. Baylor has done a really nice job and put together a protocol letter that we typically send families to that website, and we'll reference in our clinic documentation so that other physicians see it. And it's really helpful that parents bring that protocol letter with them to the emergency room in case they ever do need to take their child in. It's important to ask your doctor too to put that information front and center in your child's chart so that any other physician or advanced practice provider will see it, in the event that they're not familiar with TANGO2.
But I know a really common question that we struggled with in trying to figure out what's going on with Jake, and we hear from a lot of other families as well, is reference to episodes. And Amanda described somewhat of what those look like earlier. So Can you explain a little bit, based on what we know today, what the difference between presenting in metabolic crisis and rhabdomyolysis occurring versus the types of episodes we've seen in TANGO2 children?
Yeah, that's a really great question. And I wish I had a satisfying answer to give you that would just be like, oh, this is the time to bring your kid in, this is the time to stay home. I think in my mind, parents are the experts here. And that's the unfortunate, scary part of this disease, is that we don't know, necessarily what these symptoms mean. My best guess is that what we're dealing with is, that metabolic dysfunction is happening somewhat locally. Maybe it's inside the brain, or maybe it's inside some other part of the nervous system, not necessarily affecting the whole body to the point where you're going to see things show up on laboratory work, right? So that is a complete guess, is that we're dealing with a more kind of localized dysfunction that leads to an episode, and that can be, low energy, some of the other movement disorders that we've talked about, the drooling, decreased responsiveness. But I think the key piece to really take away, especially if you're new to this disease and it's a fairly recent diagnosis and you're not as comfortable with the ways it can manifest in your child, is always err on the side of caution. And even if it's a slog and it involves a trip to the emergency room and a lot of normal labs and a normal EKG, that's a much better scenario than missing something that can really be life-threatening.
Yeah, in addition to these potentially life-threatening life-threatening crises that you explained, the episodes that we really don't know a ton about yet, but can happen fairly frequently in certain children. There's also a bunch of other symptoms that others have noted through research and then obviously through family's observation. And one example is spasticity. Can you tell us a little bit about what that is and why we think it happens, and if there's anything we can do about it when it does?
Right. So spasticity is essentially increased muscle tone that impairs mobility in some way. And even doctors will get confused about the difference between tone and strength. You can feel it as a sort of tightness. If you passively move a limb across a joint like the knee or elbow, it can kind of feel like a molasses feeling. And we tend to see it when what's known as the upper motor neurons, and those are the ones that reside in the brain and travel down to the spinal cord, are affected in some way. When that damage occurs, basically you've got the lower motor neurons, which reside in the spinal cord, they're kind of overactive. They're not getting that inhibition from the brain. And with that overactivity, the muscle kind of remains in a tense state. That's the best way to think about it. So it's likely related, as I said, to these cells being damaged over time. There's not a lot we can do to reverse that, but we do treat spasticity in TANGO2 with various medications like baclofen and benzodiazepines. Sometimes use local Botox injections, and that can release muscle tightness in certain muscles. So another physician to maybe think about in your care team if spasticity is a major issue is a physical medicine and rehabilitation doctor. They tend to be the most comfortable managing that and are a good addition to the team if that's affecting your child.
Okay, so many of these symptoms, can be interpreted by parents as impacting movement or a movement disorder. So there's other things that have been observed, and one is ataxia or the torticollis. So can you speak to, I guess, the movement, how it impacts movement in other ways?
Yeah, and here's another area where we are still learning and still trying to explore, the underlying reasons why some of these things occur. But from what we've seen in TANGO2, there's a range of what we call movement disorders that can occur. And you mentioned some of them, Amanda. So one we call dystonia, and that can mean, just think of it as increased tone, as we talked about previously, but usually confined to one side of the body or one limb or part of the trunk. It can result in kind of leaning. It can result in stiffness and kind of abnormal walking if it's in the leg. And again, my best guess is that something is happening metabolically at a really local level that's bringing that on. The thing that differentiates it from spasticity is that it tends to be episodic, right, with dystonia. Another one that you brought up is ataxia, which can manifest as kind of a wobbly, wide-based gait as kids are walking. But it also can look like just sort of discoordination with arm movements, or generally, so they might kind of look drunk in a way. That could be a feature of ataxia. And torticollis is really tightening of the neck and trunk muscles, and that can look like the head kind of tilted to one side or another. Again, most of these, well, all of these are really episodic and intermittent and don't tend to persist, but they can be really scary when they're occurring. So one thing that's nice about living in the cell phone age is if you do see one of these things occurring in your child, is to get a video of it, because it can be really helpful for a neurologist to review that and really try to characterize what's going on. And if you're at the point where you don't know if this is part of a crisis, again, I would just emphasize the point that it's never the wrong move to have your child checked out in the moment.
And our child, since being diagnosed with TANGO2, is on a mito cocktail of vitamins and supplements that have immensely improved the quality of his life. And it's given him a lot of mental and physical stamina. So can you please tell us about what supplements are recommended for TANGO2 disease and diet and nutrition?
Yeah, sure. Again, we don't know what this protein is doing in the cells, but this condition does look a lot like mitochondrial, other mitochondrial diseases. So it seems like cells do a good job utilizing carbohydrates in the form of what we call glycogen, which is the stored form of glucose in the body, and then glucose itself, which can come from glycogen or can come from food. The breakdown of glucose, which leads to pyruvate, amino acids from proteins, fatty acids from fats, all of that happens inside the mitochondria. And that's where we think something is amiss. So it could be that TANGO2 plays a direct role in mitochondrial metabolism, which generate energy, or it could be that something else is happening outside mitochondria that TANGO2 is really critical for, to keep mitochondria running correctly. So with diet, I think the working knowledge now is that it's always nice to keep some form of carbohydrate going consistently. Now, some kids can do better without a lot of frequent carbohydrate meals, but I've known some patients that need some form of sugar every 3 hours or so, and that may be that they're not able to metabolize the fats as well. We really don't know. That's one of the ongoing mysteries. So diet and nutrition, I would say, having that carbohydrate rich snack on hand at the very least is really important. Now, the supplement piece, and you guys alluded to it, again, this comes back to the mitochondria, and we frequently will prescribe what's called a mitochondrial cocktail, which is just a number of supplements that sort of boost mitochondrial fitness in some way. And so the common ones, and you're not unique in this way, that a lot of families have seen a really positive response since starting the mitochondrial cocktail. That can include all the B complex vitamins, coenzyme Q10, L-carnitine, we'll commonly recommend some magnesium as well, which is good for muscle health. And then alpha lipoic acid, I haven't heard, but that completely makes sense. I think the main person to have on your team that's probably going to be most familiar with supplement recommendations is a geneticist who's seen some other mitochondrial disorders and can really help with what supplements to take and what are the appropriate doses to try. So that's a great question.
Yeah, I know, at least in our situation, frequent eating is been consistent in our son's life since he was a baby.
And constant hydration. You know, he takes snacks all throughout the day.
Yes.
Really helps him.
Yes, our pockets are always filled with snacks, which has been, we didn't maybe realize why, until, the way you just explained it to us was explained to us when we found out about TANGO2, but that's been consistent, at least in his life, and, has been helpful to him, I think, the constant eating and, like you said, others that have benefited from the supplements. So that's one way that, we're at least trying to, again, maintain baseline health, but also help prevent deterioration.
And I don't know if it may make sense to mention it here, but and I don't know if Jake has a G-tube or not, but some children, especially if they're more impaired and have a harder time taking food by mouth, really do benefit from having another way that parents can get food into them. And that is usually the form of a G-tube. And I think this has come up on the Facebook group a few times, is there's a lot of hesitation, understandably so, to doing, having a hole in your child's body. I think that doesn't sit well with some parents. But I can say if that's recommended, especially if there's issues with growth or there's been a rapid deterioration, and your child really can't eat when they feel so ill, it can be a really helpful tool for parents, at least to have as a backup, right? When the child's not interested in eating by mouth. So I would really encourage people to think long and hard about that and listen to their physician if that's something that's being recommended.
So in addition to, all the measures you just talked about, vitamins and supplements, what else should parents keep in mind from a diet and nutrition standpoint or from a therapeutic standpoint in, helping our kids continue to develop once they, are at a baseline level?
Yeah, I think, we probably covered the do's on the diet and nutrition. One really important don't is pertinent to children who have seizures. So as you guys know, seizures can be a part of this disease. A little over half, I believe, of kids have been reported have seizures of some kind. And sometimes we'll use the ketogenic diet as a treatment for seizures. So the basic principle of the ketogenic diet is that we are giving the brain an alternative substrate to use as fuel, and that's in the form of ketones, which are byproducts of fat. That can work really well for some kids with epilepsy. But in the context of TANGO2, with all the other things that we've talked about, with the mitochondria not working as they should, we would definitely not recommend the ketogenic diet for kids with TANGO2, thinking that it's very likely that it could precipitate crisis. So that's one thing to bear in mind once you have this diagnosis. If that gets floated by an epileptologist, just make sure that they're aware that this diagnosis is in place, and I think there's other therapies available. Now, in terms of therapies outside of medications, I know a lot of kids benefit from engaging with physical therapy and occupational therapy, speech therapy also in a lot of cases. So as much therapy as you can handle. Now, it can be a little bit of overload at some point if it's your whole life. So really that's a matter of families kind of striking a balance and prioritizing what issues are affecting my kids' quality of life the most, and really making those the priority with the schedule. And sometimes I feel like we throw so much at families. If it feels like it's too much, it's okay to make those prioritizations. But just know that there's a huge team of people out there that care about your kid and really want to see them reach their best potential.
Yeah, we've thought about them as a pretty critical part of the team we keep talking about, right? The surrounding ourselves and most importantly, our children, with a team of people that are focused on them, right? And therapy has been a big part of that. It's now a big part of, I know, a lot of TANGO2 kids' lives, but really helpful in a lot of cases. So I think with that, we've covered a lot, and we just want to say thank you for the time. And
Thank you guys.
yeah, dedication to, advancing our knowledge and treatment for TANGO2. I know the three of us all hope that this can help other families and others that are getting involved. But, since there's so little known, I think all knowledge is good knowledge at this point. So we really appreciate taking the time together today.
Yeah, it's been fun and great to meet you guys. And thank you everybody for watching.